Pacifiers are a common sight in the early lives of many babies. These simple tools offer comfort and security, soothing fussy infants and helping them sleep. For many parents, pacifiers are invaluable, especially during those challenging first months. They provide a way to calm a crying baby and offer a moment of respite for tired parents. The act of sucking is instinctive for infants, and pacifiers can satisfy this natural urge. Studies show pacifier use during sleep may reduce the risk of sudden infant death syndrome, or SIDS. However, as babies grow, the question of when to wean them off pacifiers becomes important. Awareness empowers parents to make informed decisions, ensuring pacifier use remains positive. While pacifiers can be beneficial in infancy, prolonged use can affect dental development. Constant sucking can lead to dental issues like malocclusion. This is where teeth are misaligned. Overbites and underbites are common. These affect biting and chewing. Pacifier teeth can alter tooth shape. The palate can become high and narrow. This impacts breathing and speech. Early intervention can prevent these issues. Follow expert recommendations on pacifier use. Ensure proper dental development. Prolonged use also increases the risk of biting. The impact of prolonged pacifier use extends beyond dental health, potentially affecting a child's speech and language development. When a child habitually uses a pacifier, it can restrict their tongue's movement within the mouth. This restriction can interfere with the development of the muscles necessary for proper speech articulation. As a result, children who use pacifiers for extended periods may experience delays in speech development or have difficulty pronouncing certain sounds. They may also develop speech sound distortions, making their speech difficult to understand. Studies have shown a correlation between prolonged pacifier use and a smaller vocabulary size in toddlers. Beyond speech, prolonged pacifier use can increase the risk of ear infections. The constant sucking can alter the pressure in the middle ear, making it easier for bacteria and viruses to travel from the back of the throat to the middle ear. This increased risk of ear infections can lead to discomfort, pain, and even potential hearing problems if left untreated. Additionally, prolonged pacifier use can make the transition to solid foods more challenging. Another concern is the risk of overstimulation in mouth sensory needs. Children who use pacifiers for extended periods may develop an increased need for oral stimulation. This can lead to behaviors such as biting people or objects, as they seek to satisfy their heightened oral sensory needs. Section 4. Expert advice. When and how to wean. Recognizing the potential risks associated with prolonged pacifier use, various health organizations have issued guidelines regarding appropriate pacifier use and weaning. The American Academy of Pediatrics, or AAP, recommends limiting pacifier use during wakeful hours after 6 months of age and weaning completely by 12 months. This recommendation stems from concerns about the potential impact on dental development and ear infections. The American Academy of Pediatric Dentistry, or AAPD, echoes these sentiments, advising parents to wean their children off pacifiers by age 3 to minimize the risk of dental problems. The American Academy of Family Physicians, or AAFP, also emphasizes the importance of early weaning, suggesting that parents begin the process between 6 months and 1 year of age. These recommendations highlight the need for a balanced approach to pacifier use. While pacifiers can provide comfort and security in infancy, it's crucial to prioritize a child's long-term health and development by following expert guidelines on weaning. Section 5. Practical strategies for pacifier weaning. Weaning a child off a pacifier can seem like a daunting task, but with patience, consistency, and a positive approach, it can be a smooth transition. The key is to start early and gradually reduce the child's dependence on the pacifier. One effective strategy is to limit pacifier use to specific times and places, such as nap time and bedtime. This helps the child associate the pacifier with sleep and reduces their reliance on it throughout the day. Another approach is to offer alternative sources of comfort, such as a favorite blanket, stuffed animal, or cuddling with a parent. Positive reinforcement plays a crucial role in successful weaning. Praise and reward the child when they go without the pacifier, even for short periods. This positive feedback reinforces the desired behavior and encourages the child to continue making progress. In some cases, parents may find it helpful to make the pacifier less appealing. Section 6. Supporting your child's growth and development. Navigating the world of pacifiers and their potential impact on a child's development can be a source of anxiety for parents. However, armed with the right information and a supportive approach, parents can make informed decisions that prioritize their child's well-being. Remember that every child is different, and there's no one-size-fits-all approach to pacifier weaning. What works for one child may not work for another, and that's perfectly normal. The key is to be patient, understanding, and responsive to your child's needs. If you're struggling with pacifier weaning or have concerns about your child's development, don't hesitate to seek guidance from your pediatrician or a pediatric dentist. They can provide personalized advice, address any concerns you may have, and offer support throughout the process. Ultimately, the goal is to support your child's growth and development in a loving and nurturing environment. By making informed decisions and prioritizing your child's long-term health, you can help them thrive and reach their full potential.